Let's turn to that political row over the NHS, which took place in the Commons today. Sir Keir Starmer accused the Prime Minister of letting parts of the country go without basic dental care. It comes as the government announced a new plan to boost the number of dental appointments across England. Speaking at Prime Minister's questions, the Labour leader said 14 years the Conservative government has seen the NHS fall into neglect. However, the Prime Minister criticised Labour's plan for the NHS, saying it includes billions of unfunded spending commitments. Well, we're joined on the show now by Labour's Wes Streeting. Of course, he is the Shadow Health Secretary who joins me live from Westminster. Wes, welcome to the show. Fantastic to have you on. So, the government today is throwing a lot of extra money at dentistry, an extra 200 million pledge, including 20 grand sweeteners, signing on fees for dentists who take on new patients. Is this enough?
Well, a lot of what the government put forward today in terms of extra appointments and that targeted recruitment to get dentists into areas that are the most poorly served are proposals Labour's put forward previously, so I'm not going to knock that. What I do dispute is the Prime Minister's argument that this is a recovery plan. When we put forward those measures, we were clear about the fact that those were emergency measures to deal with the immediate crisis, but we won't rebuild NHS dentistry without reform of the NHS dentistry contract. Because what's happened is that the income for dentists, the difference between what they get for their private practice and what they get for their NHS practice has widened to the extent that the dentists are now handing back the dentistry contracts. NHS dentistry has become virtually non-existent in significant parts of the country. And we've got now in dentistry a situation where those who can afford it, or in some cases people who can't afford it but are borrowing to pay for it, are going private. And those who can't afford it or can't borrow are being left behind. And it's the worst of all worlds, terrible for patients. And we've heard some horrific examples of DIY dentistry, but also bad for taxpayers, because if you don't get there early with dental problems and regularly maintaining your teeth and looking after them, you end up with conditions that take you to A&E, which costs an arm and a leg for the NHS to deal with in hospital. So it's bad for patients and bad for the taxpayer. And frankly, after 14 years of Conservative government promising to reform the NHS dentistry contract back in 2010, what we got today was too little too late. And what I couldn't believe it when the Health Secretary said, oh, we're going to do contract reform in 2025. That's after the general election. Who's she trying to kid? They broke the promise in 2010 and in 2015 and in 2017 and in 2019. What's going to make 2024 any different? And I hope people bear that in mind when they go to the ballot box later this year.
OK, Mr Streeting, let me put it to you. We have pictures on the screen now, appalling scenes in Bristol. You've no doubt seen them, hundreds and hundreds of patients queuing around the block. You were there. Situation so bad, the police were called to dissipate the crowd. What would Labour do about fixing this? And actually, is this a symptom of just the fact we've been saying for years? Dentists, GPs, schools, everything is stretched to breaking point because of increased population boom and immigration.
Well, I'll say a couple of things in response to that. I mean, I was at that practice in Bristol. At 7 o'clock this morning, there was already a queue outside, and I asked people why they were there, and I've got some absolute horror stories. I mean, one woman has taken a couple of days now off work because she's desperate to get her 14-year-old son signed up to that NHS dentist. Another woman had already paid hundreds of pounds, for a temporary filling. But to get the fix that she needs, the permanent fix, will cost her well over £1,000, and she just doesn't have it. So that's the scale of the crisis we see after 14 years. What Labour would do is fundamental reform of the NHS dentistry contract. As I've argued on GBNews plenty of times before, not all of the problems in the NHS come down to money, but I do accept that in dentistry, money is part of the answer. And what people will be shocked to hear is that last year there was a £400 million underspend in the NHS dentistry budget. And that reflects the staggering incompetence of the government, because if that 400 million quid went into contract reform, there'd be more dentists on a permanent basis. And what the dentists have said today is that the government haven't put forward a serious long-term plan that would help us to not just recruit more dentists, but retain the dentists we already have and the ones that will recruit into the future. More broadly, on population and population management, we know that is a challenge. We know that net migration are at record highs. And actually, one of the things I've been saying as the Shadow Health Secretary is that while I'm proud of the fact that lots of people have come from around the world to work in our National Health Service, that's been true for 75 years now, what we've seen is an over-reliance on recruitment of workers from overseas, often from countries that have got desperate shortages of their own, countries like Nepal, for example, where they desperately need their own healthcare workers, at the same time as we've been turning away British students with straight A grades from studying medicine and other related courses at our universities. In fact, some British universities, I'm not exaggerating this, were only taking international students because they were receiving letters from the government banning them from recruiting homegrown students. I don't think that's fair, but it's also incredibly short-sighted.
Mr. Streeting, I totally agree with that. My question was rather the number of patients that need to be treated, because we're seeing effectively a net immigration this year of almost 800,000. Goes without saying that we're going to run out of dentists, we're going to run out of GPs, we're going to run out of schools if we're not careful. How would that be tackled? Is the answer simply to throw endless money at this issue? £3 billion per year goes into dentistry already. The answer isn't money. Surely the answer is border control.
Well, I do think on immigration, of course, border control is part of the answer. That's not just true in terms of illegal migration, where I think the government's gone for gimmicks rather than serious solutions, but also in terms of managed migration. You know, if we're serious about reducing our country's reliance on overseas workers, you need a serious plan for skills, which is what Labour's put forward, with more technical education to give young people right across the country the chance to train up in those industries where we do have serious skill shortages. Because look, I recognise the fact that in the immigration debate, a lot of the anxieties that I hear when I talk to people, not just in my own constituency, where people are proud of their roots from around the world, but in other constituencies too, is that worry about the housing infrastructure, public services infrastructure, and those are legitimate concerns, and why we need to manage our migration system more effectively. And again, it comes back to what I was saying about dentistry. This lot have had 14 years now. I hope people bear that in mind and give change a chance at the next general election.
OK, Wes Streeting, Shadow Health Secretary, thank you very much for joining us on GB News. Thank you very much.